At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome Sunday. This is Dr. Tom, and we have a great program for you today, one that hopefully we can do a lot of good because there's so many people suffering from this type of malady, this impairment, this infirmity, this, what do you expect for your age type of thing? What are we talking about? We're going to talk about degenerative osteoarthritis. When your joints start breaking down, first of all, you got to know what it is because way too often it is misdiagnosed. Really, it's not there. And they say, well, you must have arthritis if you're hurt and if you're painful and you can't move. And it can be for a lot of reasons. Arthritis is one of them, and you really need to understand it completely. But more importantly, as we go on over the next couple of weeks, I want to teach you how to not only identify it, but avoid it completely. And then if you got it, unfortunately, treat it. And treat it the right way. And there's so many things that you can do. We're living in a society today that we're ending up with so many types of autoimmune and degenerative and inflammatory types of conditions. And this is one diagnostic, if you will, that seems to fall in that category across the board. Now, first of all, let's talk about the number of people just with osteoarthritis. And osteoarthritis is a degenerative arthritis. It causes your bones to break down. That's where the doc says, well, it's time to replace your hips and your knees, and we have to, fix your spine and put spacers in between the disc spaces and so forth. You have spinal and joint arthritis. Well, yes and no. So, but first, let's talk about the number of people. The number of people that's been affected is something in the neighborhood of upwards of over 40 million people in the United States. It's crazy. 40 million people just with osteoarthritis, osteodegenerative bone arthritis. Now, when you talk about arthritic conditions, what you have to understand is that osteo means bone and joint space. Now, itis means that you have an inflammation of that joint space. And you hear the term sometimes osteoarthritis and osteoarthrosis. That means the arthrosis piece is the joint is kind of broken down in a bad place, and it's been like that for a long period of time. And it can be coupled with the itis, the arthritic inflammatory reaction. So osteoarthritis causes the cartilage within the joint to begin to break down, degenerate. It has a huge inflammatory reaction, all that swelling and irritation, pain, and then the bone itself begins to be destroyed. You go to the doc and said, you don't have an option, you got to have a hip replacement, or you don't have an option, we got to replace your knees, or you don't have an option, we have to do something with your shoulder. Well, let me tell you that there's a lot of things you can do way before you get that if you recognize what the triggering mechanisms are. And that's what we're going to begin to talk about and what you can do to fix this craziness. Now, let's talk about, the overall veil with osteoarthritis. And I want you to know that there are many different types of arthritic presentations, and we'll just name a handful of them. We talked about osteoarthritis, but there are several different types of osteoarthritis. There's rheumatoid arthritis, but then you have juvenile rheumatoid and you have rheumatoid, and then you have gouty arthritis. Then you have regular juvenile idiopathic arthritis. Does that mean juvenile idiot? No, that means that idiopathic means we don't know what is causing it, but the kid's got some arthritis. And then we have psoriatic arthritis, the psoriasis that they show you on television, take this drug, suppress your immune reaction, and the skin gets clear within a period of time. Well, it can affect your spine, and that drug really doesn't do a whole lot, to save that. You have this reactive arthritis, and that is a blanket term with different types of infections that trigger arthritic conditions. And then you have something that's called ankylosing spondylitis. That's the spine fusing. It hits your spine, the spine gets inflamed, and then pretty soon it begins to fuse up and it can't move. And then you have this joint infection, and then it goes on. I mean, there's dozens and dozens of different types of arthritic conditions. The bottom line is, what's your favorite? Yeah, I said that. And I say that tongue in cheek because often when you walk into a physician's office and you complain about pain, they're usually going to diagnose you with one or two things. It's either going to be fibromyalgia, and because the medical association diagnoses that by ruling other things out, meaning they don't know where to go first to try to figure out what it is. It has this whole set of diagnostics. And then if that doesn't work, then they go, well, you must have arthritis. Actually, it can be hand in glove, which one goes first. Now, the risk factors with any type of arthritic condition, particularly osteoarthritis, they say, well, a lot of people have arthritic conditions and it's because they get older. Well, it's actually time over years. It's not necessarily because of age. And what we see is, you come into the practice and they take x-rays of somebody and they have really not good looking spines. They don't have any pain and their joint motion and so forth is pretty decent. And then you have somebody who is a younger person and they have, absolutely no signs of degeneration, but they have a lot of pain, and they say, well, this must be an arthritic condition. It gets fusing, and it's just kind of jumble talk because they don't know how to describe it. Well, we're going to describe it for you, and we're going to show you what it is and how it is over a period of time, and hopefully you'll have the opportunity to figure this out. And by the way, pencil it in, Wednesday, April the 10th, 6 p.m. at the Roselle Center for Healing in Fairfax. We're going to talk about chronic arthritic pain. And the professor, Dr. Harlan Browning, will be there with me. You know Harlan, he's amazing. And he takes very, very difficult topics and breaks it down into something that's very understandable. So make sure you join us and register as quickly as you can because you know what? Those classes fill up very rapidly, as many of you already know. So let's get back into talking about this quagmire, this arthritic breakdown, this condition that is really not any fun for anybody. It's one that causes pain, dysfunction, infirmity. You don't know what to do. I must be getting older. That's why. What do I expect from my age? I can't tell you how many times I hear that because people have been programmed truly to believe that nonsense. So we're going to kind of talk about this degenerative osteoarthritic condition that so many people have. And, we said the risk factor might be age and then overweight. Okay. We have a society where people are way too overweight, way too fat. And what happens with that is simply this. When you have 4 extra pounds on your belly, you have 40 more pounds affect leverage on your knees. So every pound is another, exponential application to that knee joint. When your head bends forward, you increase the weight of your head on your spine. Your head weighs somewhere between 12 and 15 pounds, something like that as we get older, and maybe 16. Some people say they got a big head like I do. But when you tilt your head forward, then that weight becomes 32 pounds on your spinal system. And do you think for 1 minute that your spine does not get wear and tear and break down over a period of time? I promise you it will. As soon as you off-center that gravity, the wear and tear on your spine. So we have what? We have too much weight. We have being out of shape. We have joint overuse. That means we do the same thing over and over again without supporting other parts of our body. And we have this dietary pattern that even if it's not necessarily on the surface of foods that would necessarily put weight on us, they can cause an inflammatory breakdown in the joint. What am I talking about? I'm talking about processed foods of any kind, particularly dairy and the things that they inject into our food supply and our animals. Why dairy? A patient asked me that the other day. I thought dairy is supposed to be good for you. Well, there's a yes and there's a no about that. First of all, if you're eating or drinking anything that comes from a goat or a sheep, you're safer providing that it's raw. Why does raw milk from a goat or sheep make a difference? Why does raw or milk that comes from a cow make any difference? Simply this. Let's talk about the calcium components within that substance. When it's in a raw state, straight from the nipple, if you will, or the udder of the animal, the calcium in it is something called a covalent calcium bond. Now, that can be absorbed and your body can actually use it. But once it's pasteurized, it now turns into an ionic bond, which can no longer transport into the system. So it hangs out in tissue, and it can cause tissue to be tougher, harder, less flexible, and begin to set the stage for degeneration over a period of time. Interesting, right? Nobody told you about that. Well, I'm telling you about it. So we have to understand that the quality of food that we put in our body, if it's not proper, if they're foods that are GMO, are going to cause an inflammatory cascade, an inflammatory reaction that's going to set the stage for degenerative changes that we call arthritis. Remember that there are many different forms of an arthritic condition. There, as we said, there's rheumatoid, was the immune system. We have infectious arthritic condition and so forth. But we're going to focus a little bit on this joint space, bone-to-bone problem that we end up having to do something about. In today's world, there's a lot of options, provided you clean up your act. I have a patient that went out and spent literally about $28,000 on stem cell injections. Went down to Panama at the Stem Cell Institute of Panama, which is like the go-to place right now for any of these types of problems. And he came back and, he was doing pretty well and followed his dietary patterns really well. But they told him, look, this stuff works and it'll help repair, but you got to change your diet and give it the nutrition that it needs and not put things that are problematic in your system. So all of a sudden, now a year later, he's actually doing very well, but he starts changing his diet. He starts drinking again. He starts putting foods that are processed in his body again. He starts not resting and so forth. And all of a sudden, he starts hurting again. He's throwing all of that away and not allowing the system to begin to repair properly because it takes a period of time. Here's a rule of thumb, statistics. When you try to fix something, whether you come into our office and something that I tell a patient on an ongoing basis, if you have a problem, if you have an issue with your body and it's old, it's chronic, it's going to take somewhere in the neighborhood of 3 to 5 weeks for every year that you've had an issue for it to resolve itself optimally. So if you've had something for 20 years, it may take you in the neighborhood of something in the neighborhood of maybe 20 months, maybe a year and a half, whatever it happens to be, providing that you want to optimize, providing that you're willing to do what it takes. So remember, risk factors include diet and joint overuse and too much weight. And yes, if you have a family history of degenerative disease. Now, here's the thing I want you to remember about family histories and genetic pass-throughs. Who you are right now is an expression of a few of the DNA patterns that you have in your body. And epigenetics tells us that we can either show the bad guys or we can support the good guys to express themselves. So wouldn't it make sense to you that when somebody tells you that maybe you don't have to suffer like your mother did and your great-grandmother did and so forth, that if you change a few things, that maybe the odds are in your favor that you may not end up like they did. Or if you are there already, as long as you're breathing, you probably can reverse the process significantly. I don't know about you, but that's the way my brain goes. I have a family history of different types of degenerative diseases. And by the time people were my age, they lost their teeth. And, this is old school people. Why did they do that? Well, when you go and take a look at the environments that they came from and the lifestyles that they had and the like, sure, they're going to have a problem. My mother, passed away because she had significant problems with her lungs and her health and so forth. But what did she do? Well, she was a smoker. She was a hairdresser. And back in the day, everybody in the salon smoked. And then all the fumes that were there. And the exercise they got, maybe it was just, walking around and trying to, help around the house and things of that nature. So it's important that you understand that environment is what brings about genetics. It's not the other way around. So we want to make sure that you have the opportunity to virtually change any of these joint space problems that may be presenting themselves. So remember, those risk factors are only risk factors if you're unwilling to do something with them. So they include everything from your age to the weight that you have around you, the lack of activity you have, the garbage that you put in your body, and also the mindset, the belief system that you have that will cause that to present itself. Rheumatoid arthritis is significant. So is juvenile arthritis, so psoriatic arthritis, so gouty arthritis, lupus, and so forth. They're all part of the puzzle, and we're going to get into the 100 kinds of arthritic and related. That's right, I said that, 100. There are over 100 different types of arthritic conditions that have to be diagnosed properly and managed properly to be able to reverse them and to live well without having to take tons of biologicals and things of that nature that really can destroy your health on many different levels and maybe take you out of here. So we're going to give you opportunity, and we're going to do that coming up, as I said, in-house on the 10th of April. I'd like you to join us. It's really important. By the way, those of you who haven't had the opportunity to follow me on all the social media sites, please do. You're going to find that we post things on a regular basis, but more importantly, coming up after the show today, as we do every Sunday now, we go immediately into live stream. And I have a great program for you today. We have a doctor who is well known throughout the world, but he's from Toronto, Ontario, from the Mississauga area, Dr. Ken Kanakin. Ken is a very dear friend. He's somebody who is well known in the rehabilitation and preventive sports injury arena. He has created several different platforms and opportunities. One is called Swiss, and it has to do with how injuries are overlooked and neglected and become degenerative. But he put together, the last program I was with him at his Swiss conferences was 2023 last year. He had somewhere in the neighborhood of about 500 people, from all kinds of different places. And it was really great to hear these MDs and these trainers and these physical therapists, these chiropractors, acupuncturists, talk about how to prevent injury, and not only the high elite athlete, but the one that is like you and me, we're the weekend warrior, if you will. And that's what we're going to talk about today when I interview Dr. Kanakin. He's brilliant. He's going to give you some insights from a different perspective. We're talking about arthritis, right? What a better way to really understand how to manage joint space immobility than from an expert. And that's why I invited Dr. Ken on the live stream, on Ageless Health live stream. And by the way, all you have to do is go to drtomroselle.com immediately right after the program, if you don't follow me on any of the social medias, but Dr. Tom Roselle, DrTomRoselle.com. And there'll be a banner there that says, click here. And guess what? You'll immediately be taken right into the live stream. I hope you enjoy Ageless Health's live stream, because we've designed it for you. And it's really what it says. It's Ageless Health. The information that you're going to be getting there is obviously a kind of a continuation of what we do here on the radio program. But we want to serve you at a higher level. We want to make sure that you have the opportunity to hear from many different people and to see them. And we're working it up so we can do some demonstrations, so you can be able to take a really good, solid look at, okay, this is how I did. Okay, now I got it. And also go to that site and realize that we're going to present and give you as much as we possibly can that you can take home with you and begin to, really apply things the way you should. And by the way, if you want to be a part of the Ageless Health live stream or this program, and you're somebody that is supportive of our work, we're happy to have you as an advertiser on that program. All you have to do is reach out, send us a note to drtomroselle.com and say, hey, I'm interested. The other thing that we want to encourage you is if you are ever in need of a speaker, many of our doctors at the Roselle Center for Healing do a lot of public service presentations, and we do it based on, in connection, if you will, with our foundation, Caring for Others. And many of you know about that. We'll talk about it at a different time. But this is going to be a fun next few weeks. We're going to talk about the different types of arthritic pain, the pain that just doesn't seem to go away, the one that your doctor wants you to put you on all kinds of stuff. And by the way, do you know if you're taking aspirin, I'll leave you with this one as we're coming to the end of the program. If you take aspirin or any of the NSAIDs, non-steroidal anti-inflammatories, Advils and so forth on a regular basis, it competes for something called sulfite. It's a sulfate ion that goes into the joint that helps repair it. So now it competes for that receptor site within the joint. And guess what happens? You degenerate faster and not even know that you're doing it because it decreases some of the inflammatory reactions. Your body can't fix it. You can't repair it. It's not okay. Understand that you've been duped many times over the years, and we have to make sure that you have the right information to resolve the problem. And by the way, I'm happy to talk to anyone. And if you want to set me up, just get a hold of Sybil McFarland or Dareth Painter at the Roselle Center, and they handle my personal calendar and they'll vet it. And I'm there. I'm there simply for one reason only. You deserve the information on an ongoing basis. You're the one that needs to have everything that we need to give you the truth about. We're coming up to the end of the program. Don't go away. Make sure that you join us right now on Ageless Health live stream. Dr. Ken Kanakin from Canada will be my guest. It's going to be a great show. I'll see you in just a couple minutes. I love you all.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Chronic Arthritic Pain on Wednesday, April 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.